Okay, so again, because I don't think the audio recorded, I am going to start making these videos to help everybody that is thinking of becoming a dentist or studying dentistry. So this profession, like I said a minute ago, it's not a profession that it's for everybody. If I go back, I would choose it again because I love it. I'm very happy with it. And it's not my first choice when I was little, when I was, I guess, a teenager. I was going to more to the side of medicine because my family is full of doctors and I grew up with it. So, but then once I was given a choice of being a dentist or a doctor, and I was able to see in a practice the things that were done in dentistry. Dentistry is a profession where it's very artistic. It's like almost like a sculptor. You are the sculptor of the mouth. So not only you do surgical procedures, but you also have to be sculpting, creating, shaping. So if you're very interested in that area of the arts, I think it's a very positive quality that can bring you closer to the profession. It's not just, I heard, because I had many students come to the office, to the clinic to do shadowing, where they come for a few weeks and they follow us on procedures, on how the clinic works, and then they decide. I think 100% of everybody that came to the practice liked it, and they actually are studying or they have become dentists. So it's very important that you actually see in real life what it is and what it entails, because what I went through in school is not exactly the real life. One thing is the learning process, another thing is the actual working, dealing with the patients, dealing with everything that comes with the practice. So it's not just how they used to say, oh, if you're good in science and math, you can become a doctor, you can become a dentist. But I think it entails more stuff. Also, I've heard that if you're afraid of blood, you should not become a doctor. But there are many specialties in medicine, dentistry, that they're what I call very clean. You don't have blood really, almost. Depends what you want to do. So it's very important to think a career. I'm gonna go over the actual university curriculum that you're gonna go through in another video, but I just wanted to give an insight on, it's a very artistic profession. It's 100%. It's not like when they say medicine, you have to have amazing bedside manners, or some areas in medicine you don't even see a patient. Like sometimes radiology, you don't see a patient, you read x-rays, MRIs, CT scans. But here you will have 100% relationship with the patient, because every procedure, every diagnosis, everything we do, we will do it in front of the patient or with the patient or for the patient. So it's a very one-on-one profession. I personally love that because I'm a very people person. I like to have the contact, I like to help, I love to diagnose. So that's a very positive thing that maybe you don't think about it, but it's a very, very people-oriented profession. And also, yes, you have to know science, you have to be good at science, because in the years of university, you're going to go through a lot of information, a lot of stuff. When you become a dentist, you know more about the whole body diseases, but like how to fix of the body than an actual MD, a medical doctor, would know of the oral cavity, because every disease that we find in the mouth, it's going to have some correlation to the body, so you have to learn about it. So you will have a lot of medicine included in your curriculum. There are so many subspecialties in the dental career if you choose to do it, depending if you want to do everything, if you want to have access to everything, that's one option. You become a general doctor and you can do little specialties and add, or you can specialize in areas like orthodontics, which is specializes in braces, or endodontics, which is root canals, periodontics, which is taking care of the gums and implants. That's a beautiful area, I think, of dentistry. And you have oral surgery, where you do surgical procedures to a greater extent. And you have prosthodontics, which is the areas of dentures, removable prostheses, usually combined with periodontics to do implants. And then you have pediatrics, where you exclusively treat children. That's another very important specialty, because a lot of general dentists or adult that are dedicated to adult patients don't see children, because it's a different way of treatment that you do. So if you're interested, I would recommend, if you're interested in the area of dentistry, to try to go to a dental clinic, see if you can spend a few hours a week or whatever, but try to see if you can see what goes on, if that's what you like, so that you choose the right path for your life. Because when I go every day to work, it gives me pleasure to do what I do. I'm very happy with my choice. I love what I do. I love to learn every day. I love to talk to the patients, and I think it's a right choice. But I want you to also don't question too much and do the right choice, because dentistry, compared to other professions, I consider it, I think worldwide, it's one of the most expensive cost-wise careers, because not only you have your education, you have to also, it involves a lot of materials, tools, machinery, and basically you need them in order to learn. Depends where you are, how they're offered. For example, here in the United States, when we study dentistry in school, we pay tuition, but we also have to pay for at least the school that I went to, and I know most schools, you had to pay thousands of dollars for all the equipment and all the tools that were used in the learning process. Because before you see patients, you work on tabletop mannequins or models, and you still need your tools like you would use them in clinic, because the same tools later are used on patients. So it's a very, I think, expensive. It is worthwhile, but do your research, see how things work. I'm going to talk about the curriculums in another video, like the types of classes you're gonna see, the type of topics, more or less. So very, very important. If you like, again, if you like sculpture, if you like, if you're artistic, if you like to solve the problems of people, I think it's a great choice for a profession, because you're also in the field of medicine, and you're also going to learn, and you have to keep up with everything medicine wise. For example, even if you're a dentist, and you still have to keep up with different medicine drugs that come in the market for different types of treatments. You have to always keep up, because everything is evolving, and you have to also evolve with along to keep up and to be on board with everything. So if you have any questions, I will be gladly answer them. Like I said, this is going to be an introductory video of a series of videos that if you want to become a dentist, if you have questions, I will gladly answer. Nothing comes now to my head, but again, it's a lot of studying, but I consider it worthwhile if it's something that you enjoy. Like I was told when I was little, whatever you do, and if you do it with a passion, it can be hard to get there, but once you get it, I think it's worthwhile, and doing something with pleasure, from your heart, fun, you will enjoy it, and it's not going to be considered work. So it's more, for me, it's like a pastime or something that I do. Even it's gonna sound a little crazy, but when I'm outside of the office for an extended period of time for courses or vacation, there are days that I really miss working, because I actually enjoy it a lot. So I will continue these videos another day, and I hope you send me on the comments, send me some topics about this, and I will gladly answer. Also, let me add something. I was always very creative, and I like to initiate things, create things. That's also something that I was able to apply in the practice together with my brother. We have been creating some tools to facilitate our job. We have created products for the public to use. For example, our line of whitening strips. That's something that it was kind of a little bit out. The design, the fabrication, the testing was a little bit off from dentistry, although it's a dental product. But it's something also that if you think it's more on the creative innovation side. So you can add a lot of things to the profession. It has a business side, also has a psychological part. I'll go in another extent in another video, because you talk so much to the patients, you have to listen to them, hear their stories or their cases, and that goes a lot, I think, with psychology. They never taught us that in school, but I think it's very important that you're compassionate, and you also give a little bit of feedback to the patient, because not only I think they come to get a filling, a crown, an extraction, or an implant, they also come to you to have some compassion, or they just want to talk to you about a trip they had, or they just want to tell you a daughter got married. But I think it's very important that you're a good listener too. So this is just a little bit the first step in our series of videos in this topic. If you want to become a dentist, let's see if you really are fit for this. I will also do some videos in the office to show you the different kinds of areas we work, and the machinery, the tools and everything, so you see. So thank you so much for watching the video. I hope I can help you. If your path in life is to become a dentist, I hope I can help you achieve that, and wherever you are in the world. And I hope I can, if it's something that was not in your mind, but you have the skills and you think after watching the videos that it will interest you, I would love for you to actually go to a clinic and see, and maybe I can help you become a dentist and enjoy it like I do. So thank you so much for watching the video. If you want to continue seeing the videos, feel welcome to subscribe to the channel if you haven't done yet, and to keep enjoying. And like I said, let me know what topic or what questions you have on this actual topic, and I will gladly add it on the next video. Thank you so much. I'm Dr. Valeria Soltanik. It's a very, very, very hot day in Miami, as it has been the last few days. I know the whole world is going through a heat wave, and be conscious about this climate change, please. I think especially us, again, as dentists, we throw so much garbage, so much plastic, so much disposables, and very important to recycle and do it the right way. Thank you so much. I'm Dr. Valeria Soltanik, and